as Michigan was one of the first and still is one of the few states to report its coronavirus test results and deaths out by racial and ethnic lines, it became clear that there is clearly a difference and a disparity about how this is impacting people of color and Black people in particular.
Well, joining me now is Lieutenant Governor Garlin Gilchrist. It is really good to see you. How's it going?
Thank you, Christy. My family and I are doing well. My kids are adjusting to daddy and mama, working a lot more from home and trying to teach them math with gummy bears and things like that. But my family's doing well. This has been a tough set of days, though, for our communities. I have lost 15 people in my life to COVID-19. And I know that a number of other people in my life and members of my extended family are in the hospital. So we're all trying to cope with this and fight against this together. And the governor and I are really working hard on behalf of everybody.
Yeah, I'm sorry to hear that. You know, it is intensely personal, and we have all have connections to people who have lost their lives and others who are fighting for them right now. Talk to me a little bit about what the last 35 to 40 days have been like for you in the position of Lieutenant Governor and what we've all had to react to.
Well, I think that this is certainly unlike anything that we've experienced in our lifetimes. I mean, I was actually having a conversation with my grandmother, and she was talking about her father, my great-grandfather, who lived to be 104 years old in Alabama. And she talked about how in the latter years of his life, he would talk about his mother passing away from the flu when she was 13. And he was talking about the 1918 flu when that happened. So, I mean, this is just something that has been, really, I think, a challenge that unlike anything we've ever faced. What that's meant is that people have also stepped up and come together in extraordinary and inspiring ways to contribute to our statewide response. You know, I mean, just the frontline workers, whether it's people working at grocery stores, courageously ensuring that people in our communities have food, whether it is the first responders who are still taking care of people who are having emergencies, the people who are working with utility companies to make sure that we have lights and electricity and gas and internet access. I mean, there are people who are putting themselves at greater risk of exposure so that others can stay home and stay safe. And it's those people that we're thinking about when we're making all the choices that we're making to protect and promote public health and public safety. Like, that's our number one responsibility. And most of the time, you know, we understand that, but we critically understand that during this juncture in this last month or so.
Yeah, I mean, you see today happening protests in Lansing, people in cars and holding up posters and railing against the orders that the governor has done. What has your reaction been to that showing today? Obviously, I'm sure you've seen a lot of the stuff on social media.
Well, I mean, my first reaction even before this was that people certainly can and should exercise their First Amendment rights. They just need to do so safely and responsibly and not putting themselves or others at risk of contracting COVID-19. And it appears that people have been doing that thus far. But I know this is tough. Like, we've made choices we never thought we'd have to make. We're confronting things we never thought we had to confront. And it's putting a lot of people under a lot of stress because this is scary. You know, people don't know if they have this virus, because you can carry it for 2 weeks without even knowing it. People don't know if people around them have it. People don't know what this means for our communities and how we're going to interact with one another going forward. And so I think a lot of people are just yearning for some sense of normalcy to return. And I believe that we will establish a new normal here in the state of Michigan. It's going to take some time to get there because, you know, whether it's you're talking about our economy, you're talking about our small businesses, we're putting in place measures to protect those. But we have to recognize that people come first, that our people are our economy, and that we can rethink and restart, and we're working on plans to do that. But none of that happens if people are not confident that they're safe when they leave their homes in every community in the state of Michigan. They won't patronize a business they don't feel is safe to go to. And so that's why we're making sure that we are taking as aggressive as possible steps right now so that we can, frankly, have this unprecedented action last for as little time as possible.
I want to talk about now this task force that you are heading up on racial disparities, but I want to take a step back and ask you, when did it hit you that this task force needed to be made up, and it needed to be made up quickly, and there needed to be some action taken? What was the last trigger point that you said, all right, this is what we need to do?
Well, so in the context of the pandemic, I mean, even before that, we know that there have been negative health outcomes have been happening in ways that make racial disparities very clear in our communities across the state and across the country for generations, unfortunately. And our administration has tried to be responsive to that through our Healthy Moms, Healthy Babies initiative, our poverty task force, and things like that. But as Michigan was one of the first and still is one of the few states to report its coronavirus test results and deaths out by racial and ethnic lines, it became clear that there is clearly a difference and a disparity about how this is impacting people of color and Black people in particular. So we saw that while Black people make up 14% of the population of the state of Michigan, we've accounted for 40% of the people who have died. So it was in seeing that trend and seeing that that trend has sustained itself over a set of days, we knew that we needed to act and act quickly. And Michigan, frankly, is a national leader here. There's only one other state that has established a group that is looking at this problem specifically. And we're pulling together experts from all different expertise and walks of life, whether it is epidemiologists and infectious disease experts, experts on medical bias, but also people who are representing the faith community and the labor community, because a lot of those frontline jobs that I spoke to earlier are union jobs that are disproportionately held by people of color. But there are interventions that we can put on the ground and in the street right now to keep those people more safe, to keep people safe who are relying on public transportation even in the midst of this crisis, to make sure that people have access to testing. And actually the task force has already taken action to work with Chief Medical Executive Dr. Jonae Caldoun to expand access to testing greatly, which will allow us to better have our arms around community spread, in particular in communities of color like the city of Detroit. So we're taking action immediately, which I think is unique. Most task forces, they do their work and then they develop a report. We're taking action on an ongoing basis, already starting on Monday, and we're going to be releasing, announcing our actions that we're taking on at least a weekly basis to make sure that we can intervene as quickly as possible, because every day is another set of lives that could be lost that we can prevent.
So tell me exactly who is on the task force. There's going to be 15 to 20 members?
Yeah, so it's a little over 20 people, and we tried to, again, reach from a cross-section of the community. So on the medical and public health side, we have folks like Dr. Audrey Gregory, who is the head of the Detroit Medical Center, Dean Roush from the Michigan State School of Nursing. Again, we have epidemiologists from inside and outside of state government and infectious disease experts. We have faith leaders, or Reverend Solomon Kenlock. We have Congresswoman Brenda Lawrence, who represents some of the state areas in the state that have been most deeply affected by this. We have Ray Curry representing the labor movement. He's with UAW, again, because so many people who have union jobs are deeply impacted by this directly. We have participation from nearly every state agency that has to do with our statewide response to ensure that whether it's everything from budget and treasury to licensing and regulatory affairs to small business supports, that we are making sure that we have things that can impact our communities. And of course, Chief Medical Executive Dr. Jonae Caldoun and the Department of Health and Human Services are represented as well. So we tried to have a cross-section, and I'm even leaving some stuff out. I mean, we have community leaders such as Maureen Taylor, who's representing the perspective of seniors and homeless advocates. We have people representing young professionals. So it's really tried to be a pretty broad cross-section.
You know, sometimes some of this also comes down to policy, and it comes down to policy decisions that have been made long ago that have adversely impacted the Black community in our state. Do you hear from, we talk about working across the aisle, do you hear from other members of the Republican Party and the legislature about some kind of policy initiatives that you can take, whether it look at healthcare, whether it looks at being access to a better food supply in certain areas of the city?
Well, there are certainly members of the Michigan legislature who care deeply about this. Representing the Detroit caucus is Representative Sherry Gay Dagnogo on the task force, and representing the Michigan Legislative Black Caucus is State Senator Marshall Bullock. So we do have a legislative perspective that is visible there. And I believe that there are Republicans in Michigan who do care about this issue because they don't want to see their neighbors and their friends and the people who go to school with their kids get sick either. So we're looking forward to working with them to bring forward ideas. COVID-19 does not respect politics. COVID-19 is something that is impacting all of our communities, and none of us are safe because of any sort of partisan affiliation. And so it's important that we have a strong statewide response to this, that we make testing widely available across the state. And that is why we've been advocating so fiercely with the federal government to make sure that we have more testing kits and testing capacity, testing components here in the state of Michigan. We're working to procure them from the federal government, as well as procure them from private sector sources around the country and around the world. And that's why we've been able to ramp up testing in the city and in drive-through sites across the state. And we're going to continue to do that as we widen the testing protocols so we can better respond to this virus.
Do you think that you've been able to get an accurate number count in terms of people who have been affected by this? I talked to Wayne County Executive Warren Evans the other day. He was concerned that maybe they don't even have accurate data, because sometimes when you're looking at forms, people aren't filling out race, or they're not able to, in like 30% of the cases, they have unknown. So do you believe that you've been able to accurately count, and, or if not, be able to change or put something in place that you're going to have a more accurate picture of who is actually affected?
Well, we're working to improve that data collection because, yes, there still are a high proportion of people, or too high a proportion of cases that have been race unknown, and we need to understand that. And again, the DHHS team is going to be working with hospital systems and county health directors to ensure that we're getting as accurate data as possible. Another action you're going to see from this task force is supporting the leadership of Congresswoman Lawrence and the Michigan delegation that will call on the federal government to also report out consistently and require reporting on race and ethnicity, something that does not happen across the board when it comes to federal public health data. So there is more that we can learn. And the better the data and information, the more informed the choices that we make are from a policy perspective and from a protocol perspective, because we're trying to act immediately to save lives. So I think that there can always be improvement. You know, I'm an engineer, I'm a data guy, so I care very deeply about us having accurate and high quality information, and everyone in the task force is aligned in that being a priority. And so some of the early action you see is gonna be in that vein, I'm sure.
Yeah, and I think people appreciate early action, or at least being able to say, this week we are taking these steps forward. But the long-term picture, looking at environmental justice, looking at communities of color disproportionately in areas of pollution, looking at water shutoffs, and those are some of the bigger health pictures that need to be addressed also coming out of this.
Absolutely. I mean, COVID-19 has proven to be deadly for people who have particular sets of either underlying conditions or environmental factors that are contributing to poor health beginnings and outcomes, frankly. And so when we're looking at those social determinants of health, those are also contributors that we want to wrap our arms around in the longer term. But a legislator actually shared with me today a study from Harvard that showed that if people had asthma or had some other sort of lived in an environment that had significant air pollution, like, for example, Southwest Detroit and in Dearborn, they are much more highly susceptible to infection with the coronavirus. And so these are the kinds of things we need to think about what the policy responses are, both in the immediate and in the long term, to make sure our people are healthier. But we have seen that COVID-19 tends to impact people more deeply when they have asthma, or when they have diabetes, or when they have high blood pressure. And these, unfortunately, are ailments that disproportionately impact Black people and other people of color. And so these things are connected. And we believe that if we can design interventions in the short term, they will inform interventions that we can make in the longer term to address these racial disparities.
Who else are you looking at across the country that you would pick up the phone and say, hey, I want to see what they're doing in their state or in their region, and talk to them about it?
Well, thankfully, thanks to the National Lieutenant Governors Association, I have a very strong network of my counterparts across the country. And this racial disparity has shown itself in a number of other places, cities and states, places like Chicago or New Orleans. And I have very strong relationships with the lieutenant governors of those states, respectively. And I actually called those two out for another reason, that this is bipartisan. Lieutenant Governor of Louisiana is a Republican, and Lieutenant Governor of Illinois is a Democrat. And we're all working together because we want to save the people who we serve and make sure that we can put in place policies, practices, protocols, and programs to make sure that we can address these needs quickly. But I think also people are going to look to Michigan's leadership. Again, this sort of task force looking at this in real time only exists in one other state, and that's New York. We believe that things that we learn will be exportable to other places so we can save lives in Michigan and around the country.
You have kids, I have kids. I think a lot about how this generation of children will be forever changed by what they're experiencing right now and by what we're going through. What do you hope for this next generation of kids living through something like this? How do you hope that they will be changed?
Well, you know, two things. This is hitting kids in a real way. I have twin 6-year-olds, and my 6-year-old daughter came to my wife about a week ago and asked if we were still going to have Christmas. So kids are thinking about this in a real and deep way, and we need to make sure we're having age-appropriate conversations with our children about what's happening, because they have questions and they're stressed out. They're home from school and they don't really understand why, and we need to talk with them about this. So I would say a couple of things. One, making sure that we have empathy for everyone in this time. This is unprecedented. People who are able to be home and work from home are doing it in a way they never would have imagined before. Educators are learning how to facilitate learning at a distance. And, one of the things that I'm working on is making sure that children across the state have access to the internet and access to internet-enabled devices so they can still learn things. And that access is very stratified based on urban versus rural divides as well as socioeconomic divides. So working to make sure the state can help with that. But ultimately, I believe that the irony of all of this social distancing is that it actually reveals how connected we actually are. It reveals how reliant we are upon one another. It reveals that the individual choices we make and the actions that we take impact our community's collective well-being. And so I think on the other side of this, we are actually going to hug one another a little tighter. We're going to check in on one another more often and a little bit more substantively. We're going to look out for one another. We're going to make sure our people are okay. And I think that will lead to a better connected community. And I think that is a beautiful thing. That will be the beautiful sunshine to emerge from this dark night that we are going through right now. But we will get through it by working together, by being empathetic with one another, and by focusing on the solutions that we can make happen. And so I'm optimistic because the people of Michigan are resilient. The people of my city of Detroit are tough and strong, and we can get through anything, and we're going to get through this too. We're going to remember those in our lives who we've lost, and we're going to honor them by being better connected as a community.
Yeah, I think the empathy is a very important thing. Lieutenant Governor Garlin Gilchrist, it's good to see you. I hope your extended family continues to recover and be well.
Thank you very much. You be well too, and everyone, please stay safe.
You can find more at onedetroitpbs.org or subscribe to our social media channels and sign up for our One Detroit newsletter.